Welcome to the session where Sunrise Supported Living Limited offers hints and tips about parenting. Today is the 29th of February 2024. I will be briefly discussing mental health and self-medication through use of cannabis. We know that mental health is not something of choice. It's a condition that you may suffer. It could be something hereditary. It could be certain life experiences, shock and so forth, which could lead to that. But you would get more explanations about mental health from mental health practitioners or GPs. My main interest is in how it affects children and how we can try to help children to enjoy almost similar life with children who are brought up by parents who are not suffering poor mental health. Poor mental health can manifest itself in different forms. I'll just mention some different forms on how it could manifest itself. It could be depression, it could be anxiety, bipolar disorder, schizophrenia, personality disorder. All these explanations, you can get them from psychiatrists or from practitioners who specialize in mental health. My main interest is only on how it affects children and also the risks that society can suffer if poor mental health is not addressed. We know that people can be parents, but also they can be elected to positions of leadership. It could just be a simple manager, or it could end up being an MP, a cabinet minister, or actually the leader of the country, whether president or prime minister. If there are some issues with one's poor mental health, or the lived experiences would suggest that your behavior is impulsive. That means it will affect the whole nation because you may take some decisions abruptly without considering long-term consequences, and that could be hazardous to the nation. But we look at children as they are being brought up. How would this affect them? Will they enjoy the same care as the other children? How will it affect them in their cognitive development, in their social skills? How do they view the world? How do they interact with others? So, as I've already stated, different forms of how poor mental health could manifest itself. What I'll just be interested in to discuss it's how it affects children. We know that people, whether you say they are born blank or they've got any understanding, but if any understanding, they've got very little understanding. They are to learn more as they interact with the world, as they are taught by their parents, as they observe people's behavior, as they imitate those they consider as their role models. So in terms of poor mental health, I'll say it affects to those who are adults, those possibly caring for children. You find that they could feel extremely tired. They could not feel comfortable in interacting with others or being involved in any social activities. So they want to keep themselves away from others. At times they just feel worried. They can't identify exactly the source of the worry. At times they are very irritable. They've got a short temper. They are intolerant. Their behavior is chaotic. They touch on that one and touch on this, do something else, maybe even without completing one task, jump onto another one. Some have got sleepless nights. So during the day when children are up and running, when they should be receiving care, that's when they feel sleepy. Some will go for days without feeling sleepy. Then they'll feel sleepy at some other point. So it's all this on how does this affect children? Because the worry for those who have got an interest in the welfare of children is on how this impacts on children and how can children be supported. In working with children, the main thing is that the encouragement is that those who are suffering poor mental health should seek advice from health professionals. And some do very well. They comply with that. But at times, the prescription given, it makes the person feel weird, suffer some side effects. Some find it very difficult to take that medication until they use cannabis, which they find at least helpful in helping them with their mental health. I will discuss that and see what effects it could have, why it is discouraged. So briefly looking at the behavior in terms of those suffering mental health who have got responsibility of caring for children, the worry stems from that children learn, and they learn not only by instruction, also by observation. And if they identify someone as their role model, they want to imitate, copy everything that they are doing. So if we put it into context, say someone who is chaotic, someone who is irritable, if the child copies that lifestyle, then that's where the worries stem from. Someone who cannot control their emotions, is verbally abusive, can shout. One extreme is very happy. One extreme is very sad, angry. So the child doesn't really know how to respond to specific situation and identify as to the outcome of certain behaviors. That's the worries that we're looking at. So I've already mentioned imitation. I've said in terms of role model, if for people copy that behavior, impulsive behavior, you want children to display socially acceptable behavior where they can maintain friendship. If they are in class, they are not to be disruptive. But if it's a question of impulsive behavior, they can do anything anytime when other students want to concentrate. In terms of the parents, if they are feeling tired, they've had bad sleepless nights, they feel withdrawn. In terms of supervising children, it will be a difficult task because children like to play. And when they are feeling so tired, they want to be in bed throughout. Some will actually lock the door, draw all curtains, close windows that no one can see them. Some even watching TV, if their behavior is more linked to a schizophrenic, the mental health, they feel that the people really in the shown on the TV are actually intending to attack them, or they're actually spying on them. So the children can't even watch TV. That becomes an issue that we need to support children to help them at least enjoy the same lifestyle that is enjoyed by other children. In terms of setting routines and boundaries, if one is impulsive, today you don't have a meal, tomorrow it's one time it's at 12 noon, one time is 2, one time is 3. Sleeping patterns, they are not clear. Children go to bed, there is no defined time. That becomes a source of worry. In addition, also children at times have got to take extra responsibility. You find that the parent is totally withdrawn. They don't want to come out of bed. If it's a single parent, the eldest child, the risk is that that child will take extra responsibility, now looking after his or her siblings. In terms of preparing children for school, they've got to do it on their own. Such children often will be late at school, will miss lessons. That means now their functioning is unlikely to be at a similar level with children of their age group. So they are likely to need extra lessons. They are likely to be behind others and require to be assisted to catch up with their age group. So we can see where children are sleeping from functioning at their expected age group levels. So these are difficulties, as I've said, that I am pointing out just some difficulties that can arise that at times would lead to children finding it difficult to function or to be enrolled and sustain mainstream education, because teachers will find it difficult if a child is disruptive, is impulsive. Some, they will even climb on desks, bang desks, shout, slight annoying. If they are annoyed by something, at times they'll be verbally abusive. It could also be something they have observed between their parents, because if they are suffering poor mental health, at times managing their emotions becomes quite difficult. So the rest of the parents, if they learn that in the children's class there is a child who is always disruptive, who at times throws whatever items either to the teacher or to some of the students, parents will get worried and say that our children are not safe in that class, and therefore the school has no choice. But in such circumstances, they try to assist the child, but if they are unable to help the child to be settled, then they've got to look for alternative educational arrangements where at least the child will have a small ratio between the teacher and child. They are being assisted to address their social skills, their emotional development, without affecting the rest of the children. That's when we'll help children now attending alternative education, not being in mainstream. The worry in that situation is that this child, if the child doesn't acquire appropriate social skills, what if this child grows up and at some point is elected to a leadership position? Impulsive decisions that are made could affect the rest of the nation. If the child didn't maybe found it difficult to settle in alternative education, the child's life opportunities could be greatly reduced. Some will not even attend lessons. They will start absconding. That means the skills necessary for employment or for job creation, for being an entrepreneur, all those are lost, because in terms of education, the child has significantly lost what they could have acquired. Their skills in reading, in maths, in science, all those are significantly affected. So when people who are worried with children's development, where they are offered care by parents or adults who suffer mental health, there shouldn't be a lot of panic or worries, but assistance should be welcomed, so that at least arrangements could be put in place to help children acquire the skills that are acquired by other children who are brought up by children who are not suffering, those who are brought up by parents who are not suffering poor mental health. I'll just say briefly what at times you may find those who are helping, what they may ask for is whether as parents you have got any significant friends or family members who could be of help. This is to help in making sure that children grow up in an environment where routines are set, where their needs are prioritized, where they are attended to when they request help, and where the adults or family members or friends who are close to you come to your help when you are suffering poor mental health during that particular episode of suffering poor mental health. Children grow up knowing what is acceptable, what is not acceptable, what is socially acceptable behavior, and what is anti-social behavior. That does help a lot. So when those who are supporting children ask for friends or significant family members, do help them with that. They will come in at times when you are feeling withdrawn, you don't feel prepared to be in a social environment, you can't go out, take your children either to activities or to school. If your children are grown up, or if there is someone who can help, either they can just be phoning you, checking up that is it everything okay, or if we have got a grown-up child, they can quickly phone someone who is significant and say, today we feel our parent is not enjoying good emotional well-being, and they can come in, take children either to school, take children for activities, which would be of great help. But as I already mentioned, there are times when prescriptions that are given, at times the person who is prescribed feels side effects that they cannot control, and they find it quite difficult until they abandon taking medication, and then at times they resort to the use of cannabis, which at times they find it helpful. And there are times when medication given makes the parent or the carer feel extremely tired, exhausted, and they feel they can't do anything. So at that time, the parent is complying, is doing everything. But if there is an emergency at school, after they have taken medication, they'll be flat or asleep. They can't actually get up. Or they are feeling so exhausted that they can't even walk a distance. So in that situation, parents are complying. So there are a lot of risks, because if there is an emergency at school for the child to be picked up, they can't. If they take medication overnight, suppose there is an emergency at night, that means they will not be in a state that they can help children. That's where I've said that helping with families or friends who can help, that could be of significant help in children being prioritized, their needs being met. In terms of the use of cannabis, the challenge is that whilst the carer or the parent could feel that cannabis is helpful, but there are a number of negative factors. When you take cannabis, one, it means that now there is a cost. So you are buying cannabis, which could be costly, and it could make it difficult for you to sustain any employment because it affects your emotional well-being and functioning. Some companies will not accept people who take cannabis. So that means your budget now is very low. It will be difficult to meet your children's needs. The other aspect now is that if with children, you may get advice to say, don't smoke in the house. Maybe you are a compliant parent, you are good, you want to do the best for your children, you smoke outside. But there are issues that some of the particles will stick to your clothes. When you return to the house, that affects children via passive smoking. So they will also be smoking. And the concern is that if they are babies, their lungs are not yet that developed. It affects their airwaves. It's now impacting on your children's well-being. As we know that some of the concerns with poor mental health will be that of difficulties in maintaining routines. So even if there is advice that whenever you smoke outside, make sure that you take off the clothes that you were wearing at that time, or take a bath, make sure that those clothes are washed. But because it's difficult to maintain a routine, you are likely to come back to the house and children will inhale cannabis via passive smoking. And also it's likely to affect your emotional well-being again. That means the risks of shouting, being irritable, children being victims of domestic abuse, all that now will be an issue that is of a great worry. That's part of the issues that are with the use of cannabis to try and address poor mental health. And babies, they will be at risks of suffering health conditions such as asthma, because they are still developing, their lungs are still developing. All chest infections, they are likely to be exposed to all that. Coughing, wheezing, shortness of breath. All these are issues that people who have got worries with children lead them to get involved with families that suffer poor mental health and use cannabis to address these concerns. So if you welcome the support offered, they've got an in-depth experience, knowledge of supporting children in such environments, and they will be advising, working with you to make sure that your children's development is not affected or excessively affected by your poor mental health, and also by the use of cannabis to address a poor mental health. It is a community and the nation's worry if not much effort and support is offered, because these children could grow up to leadership positions without having acquired appropriate social skills, having been victims of domestic abuse, not having had experience of being prioritized as children, making impulsive decisions. This becomes an issue to the nation. So today I was just giving a brief discussion regarding poor mental health, use of cannabis to address the poor mental health, and how it impacts to children. I will meet you again in another session. Thank you for listening. Meet you some other time. Thanks. Bye.